All right, so here we are with another mobilization and strength training exercise routine that we can implement for our forearms and wrists. I know as of recent there have been a lot of complaints for brachioradialis and some of these extensor and some of these flexor muscles here. So the first thing you want to start off with is some myofascial release or some type of mobility exercise in order to get the full range of motion, and then follow up some type of corrective exercise. So sometimes we have pain crossing over this joint space here, which is like this meaty portion of your forearm, which is kind of like your brachioradialis here. So it crosses over this joint space. So what you'd want to do is start with your arm flexed, or I guess relaxed but contracted here. Use your fingertips to grip into those tissues there, and then fully extend the arm out. And then from here, can you, while gripping there and tacking down the tissues, can you make a fist and flex up, down, clockwise, counterclockwise, and trying to massage it out? And you are looking for areas of discomfort within that space. So for me, I feel some tension here, and I'm trying to go up, down, clockwise, counterclockwise, and slowly walking my fingers along that muscle length there, or that muscle path. And then from there, so after you do this for a minute or two, can you go through some corrective exercise? So something that you can do, if you didn't have any weights or anything, you can use resistance bands or weights, kettlebells, whatever it may be, to go through these types of various exercises. But if you didn't have those, what you do is you can add some resistance into this, try to let the wrist go back and forth, and try to add flexion in this aspect, or this, what we consider this radial deviation. Then you can turn it over, place pressure on the back side of the wrist, try and do some extension movements here. You can also place it on the outside portion, trying to flex your wrist the other way. And then the other, lastly, would be some of these flexion movements here. So trying to, once again, work on the flexor and basically the extensors, the entire radius of this forearm, and you're trying to work on the musculature components there. So I would say start off with that. If there's any pain or discomfort, obviously stay away from that. But if your pain is consistent, you can go ahead and reach out to Fire Wellness, and we are willing to set up an appointment with you and go from there.